I'm Dr. Drew Hanks, and today we're going to go through our basic cat physical exam. We have one of our clinic cats, Blackie, here with us, and we're going to do this in our new cat room we have. So with any problem that we have, we're going to start off with a good physical exam, and I hope today this video will kind of show you the different things that we're looking at and trying to pick up on to discover what disease process or problem may be going on with your animal. With the physical exam, it will be a little bit different for each doctor, but the main thing is we have a system, and we try to follow that system in the same way each time to make sure we don't miss something. So with my physical exam, I'm going to start at the head and work my way to the tail. Starting off, I'm always going to start my exam by just watching the animal move around the room and see how they move around. I'll typically do this when we're getting the history from the client. After that, I'll put the animal on the table, and I'll start by looking at their eyes. With the eyes, I'm looking to make sure there's not any obvious discharge, obvious ocular opacity such as cataracts present. Then I will test to make sure they can see by doing a menace response, where I move my hand towards the eyes. The normal response is the animal will blink, letting us know that they are visual. We'll also test their palpebral reflex by touching them right on the inside of their eyes as well. Also, I'll be looking at to make sure there's not any obvious redness or eyelid abnormalities going on. Then I'll typically look at their face, evaluate it for symmetry, make sure there aren't any abnormal swellings or anything going on. Then typically open their mouth, evaluate the patient for any dental tartar or things of that nature, make sure there aren't any abnormal masses present. Then typically I'm going to palpate under their jaws to look for their lymph nodes and feel them. More than anything, make sure they're symmetrical and not enlarged. Then I'll also feel right in front of their shoulders to feel the prescapular lymph nodes to make sure they're normal size as well. Then typically we're going to look at the ears, make sure there's not any obvious debris or discharge present. Also feeling the inside of the ear to make sure it's not roughened. If we see any abnormalities that could be indicative of something like an ear infection, then we'll go get an otoscope and actually look down in the canal. And then, of course, if we do think there may be an infection, we would take an ear swab, look at it under the microscope, and assess it for any organisms that may be present. Typically, after kind of looking at the face, I'll feel of their neck, make sure there's not any swellings on the ventral part of their neck, down their front limbs, feeling for any lumps and bumps that may be present. Then we'll typically kind of turn the animal around and continue working from head to tail. I'll palpate their chest. Feel for any abnormalities, lumps or bumps that may be present. In a cat, I'll kind of compress their chest to make sure it compresses and has a give to it. Then typically work my way back to the abdomen and start assessing the abdominal structures to make sure there aren't any abnormalities present. After that, feeling throughout the abdomen, make sure all that feels good. Typically then I'll go to the back legs, feel the lymph nodes in the back part of those legs. Raise the tail, make sure everything looks good back there. And then just feel one more time to make sure we haven't missed any lumps or bumps that may be present. Typically at the end of the exam, I'll auscultate the cat, make sure we have normal heart and lung sounds. So the heart, we're making sure we don't hear any murmurs, making sure we have a normal heart rate. And then with the lungs, making sure there aren't any harsh lung sounds present. After we do this, then we'll take all the information we've gotten from our exam. We'll pair that with the history that you've given us, and then we'll go forward and decide what diagnostics we may need to try to figure out what's going on with your patient.